We're going to lead with some tools for how to engage people, for how to assess where someone's at in regard to a chemical dependency issue. And my hope is, as Christine had mentioned and I had mentioned before, my hope is that we're able to look at people as whole people. If I'm having a heart attack and I'm also having an aneurysm, which one should the doctor treat? Both. Please don't let me die of a heart attack while you're fixing my aneurysm. That doesn't make much sense to me. We treat whole people. We also relate to whole people. How do you feel when you're going to a supermarket or you're going to a restaurant and the person's relating to you as a thing? Keep it moving. What do you want? Here's your chicken. We relate to human beings. We don't relate to diagnoses. We don't relate to stigmas. We don't relate to numbers. We're going to start off with risk factors. These are things that if you're looking at a human being or you're looking at yourself and you're trying to determine, is there a potential for an addiction here or is there already an addiction here? These are things that will increase the likelihood that an addiction is present or will be present. Okay? So let's start off. One of the things I want to talk about is the age of onset. How many people here drank their first drink after they were 21? Okay, we got 2 hands. How many people prior? I feel like we just got to wave at the Eagles. Everybody. The earlier the first use, the more likely the person is going to develop a significant substance-related issue. When you get around puberty, now mind you, there are alcoholics, people who would classify themselves as alcoholics, or people who would say, I have an addiction issue, that didn't use till they were 30, didn't use till they were 40. But the younger, the greater the likelihood. When we get around puberty, and Christine alluded to this when she was talking about not developing certain skills, because the mental health hit before those skills were cultivated. There are changes that happen in our body, changes that happen in social interactions that occur in puberty. So when you get somebody who started drinking at 14, or when you get somebody who started drinking at 9, or someone who started using inhalants at 9, then you get someone who went through all those biological changes, all those social changes, high. They didn't develop ways of coping with those things or coping with those people that didn't involve a substance. So where the average kid goes from, I was playing with my Teenage Mutant Ninja Turtles, and it was great, and I love Bobby, he's awesome. And then they move to dealing with the anxiety of walking up to a girl and asking her to prom, and having to develop that inside themselves. I was drunk. She said, no, who cares? Wouldn't ask her if I wasn't drunk. I was drunk. She said, yes, great. I didn't have to do the math. I didn't have to do the internal process. I had an external thing that made that easier. So now what happens when you get sober? You never did the process. How do you make a friend? I don't know. I never did. The earlier the age, the greater the likelihood that it will develop into a problematic chemical dependency. Route of administration. Cocaine is the best drug in the world to look at because our society has decided to use cocaine in every fashion, form possible. Back in the day, people chewed coca leaves. They ingested it orally. That was slow and addictive, and people died. But it wasn't good enough for people who wanted to use cocaine, so they refined it, made it powder. So now we snort it. That was better. More people died. More people developed deeper dependency on it because we refined it. We made it easier to get, to hit harder and quicker. Well, then some genius decided to create crack cocaine. So now we smoke it. It goes into the lungs, not into the stomach, and not through the nose. hits harder, hits quicker, more dependency. You can also IV use cocaine. When you see someone using a substance, the route of administration matters. Now, can someone chew a coca leaf and become dependent on it? Absolutely. Can someone die from it? You bet. Basketball fans, you guys will know this better than I. There was one guy who was a huge draft pick, and Bias, was it? Glenn Bias. Supposedly did his first line of cocaine and died. However, when someone is smoking crack as opposed to chewing on a coca leaf, the likelihood that that will become a dependency and not an experience is increased. With alcohol, same thing. You see a 21-year-old drinking beer. Are they definitely going to develop an alcohol issue? No. Some do, some don't. If they're drinking liquor, likelihood increase? Yeah. Could they still be dependent on alcohol? Yes. They're drinking a fifth a day. Well, that's progressed. The kind of substance someone's using, the way that they're using it, matters. When we see people using substances in progressed fashions, we can't say, oh, well, boys will be boys. Teenagers will be teenagers. They're using IV drugs. That's a progression. That's not experimentation. So it's important to look at that. Co-occurring disorders. Someone who has a mental health issue is at a greater likelihood for developing a chemical dependency. We had the chicken and egg question earlier. And it's been a question that's really fractioned recovery efforts for a long time. You went to AA and the AA person said, you just worry about a drink a day at a time, that's it. It's like, but I'm hearing voices. Tell your sponsor. Work the first step. My sponsor said he's hearing voices too. Great. You go to the mental health person who's trying to go to a psychiatrist that gives me pills. I'm drinking on my pills. I'm talking to a person about my trauma. And we're going to get into trauma. And when I leave, I want to drink. When someone has any form of mental health issue and they begin using substances, whether it's the mental health driving it or just creating a greater potential, who cares? If someone has this issue, the likelihood of that issue becoming problematic is increased exponentially. And there are other factors that also make it a greater likelihood. In focusing on trauma for a minute, because that's an important one I want to draw some distinctions on. There's a current trend in thinking that says if you're an addict or an alcoholic, if you're identifying yourself as that, you definitely have trauma. The one precedes the other. All addictions come from root of trauma. There's another philosophy that doesn't believe that. I believe that many people's addictions are fueled by trauma, and we're going to talk about that and how we can help that. And I believe that some people are just self-medicating trauma, but I don't believe it's root cause, because my clients for decades have told me differently. I've had clients who told me, I never had a traumatic experience. I got prescribed Percocet, and all of a sudden my life changed. Until someone can show me differently, I'm believing that person and my own experience as a clinician. Trauma triggers and triggers to use. I want everybody here to leave understanding both a little bit. A trauma trigger can necessitate a trigger to use, but they're separate things. We're going to talk about some skills you can leave with that will help both. We're going to start with a trigger to use. I'm going to use where we filled in a lot. I'm going to use this row. And we're going to stop at Sarah, start at Ted. We're going to do the alphabet together. I say A. Ted says B. Back to me, back to Jenna, back to Ginger. So let's begin. I say A, Ted, you're B. A.
B.
C. E. Q. Okay. I just threw Sarah off all day long. For all the OCD people in the room that I just triggered, I apologize. I will pay the co-payments for your medications. Here is why this is important. We develop circuitry in our brains that tells us when this happens, that happens. When A happens, B happens. When you go off script, everybody in this room was like, Q, what's wrong with you? It throws something off in our heads. What do you think happens to an addict or an alcoholic when they're at a barbecue? What does barbecue mean? Barbecue's A. Drinking's B. It's New Year's. Somebody died. Especially all you Irish people out there. Irish wake. Somebody's getting married. There's a circuit that we formed. I feel pain. Opiate addicts. Are you kidding me? I don't feel pain. I'm an opiate addict. When these things happen, there's the circuit. So the trigger to use comes when the circuit's triggered and we don't know how to not move without completing the circuit. I've had people tell me that they were drinking before they realized it because the circuit was that ingrained. They just started. Trauma trigger is a trigger to use. Yes, ma'am?
So when you got to Sarah,
Yes.
and you said Q, and she didn't know how to respond, how is that related to trauma, this circuitry? What happened, like, is that like a break in the circuit where
You have to build a new groove.
that's, you're saying that that's the trigger to, I mean, that's the scenario where she has to have learn a different response?
And it has to be ingrained. Now you think about it, ABCs have been with us since kindergarten. How long has the trigger to use been there? 10 years, 20 years, 15 years? If it's been a year, that's an ingrained pattern. Switching that pattern and making stress become, I pray, I call someone, I do cardio. You have to do that so frequently, so repetitively. That's why intuitively AA and NA and other 12-step programs give you these cliche circuits of repetition. That's why they say do it for 90 days. Go to a meeting every day for 90 days. That's a circuit. It takes at least 3 months to build a circuit. I heard police say the same thing about buckling your safety belt. If you do it for 90 days straight, forcibly, you'll do it as a normal response when you get in the car. You never lose the old circuitry. So, warm day will still elicit cold beer, but we can build a new bridge. Any other questions? Yes, sir.
Not a question, but you building on to your response to that question, it shows you on even such a simple task how hard it is to change it.
Yes.
Right? Because we all got stuck. It wasn't just my hair. We all cute.
Yes. Yeah, it goes against the grain. The repetition's hugely important, and we need community around it. We need structure to make sure that we're implementing it well. And even then, I know a woman who retired. She had 35 years sober, moved to Florida. She was around people that were drinking. You know, she went to the little elderly establishment, and everybody was playing Frankie Valli, and she relapsed. Yes.
Rick, I have an example, similar example, that maybe sort of just gives a different perspective on it. If you've lived in your house